So let's talk about mental health. So mental health grew out of the vision of Dr. B.J. Miller, who's been just a powerful voice in the palliative care movement. What gap did B.J. see in the current system that convinced him something like mental health needed to exist?
When BJ and I were creating Mettle, it was really born out of his lived experience. And I think that the lived experience of a lot of clinicians in palliative care and hospice and other spaces of the reduction of time and human interaction between people providing the care in a healthcare setting and the people receiving that care. And basing what we wanted to do off of the beauty of what palliative care is meant to be, this addressing of every type of human suffering. And if that's the goal, how can we really tend to all of that in 15-minute quote encounters? There's not enough time to talk about how your diagnosis is affecting your sense of self, what it's doing to your relationships, how it's affecting your work, all of these things that are really important to us as humans outside of what is happening in our body. The definition of Mettle, finding one's own resilience during difficult times, that's what I think we are actively trying to do. We are not trying to become the place that does the thing for you. We are not trying to become the place that gives you the answer. We are trying to become the place that helps you build a new muscle to cope with difficulty when you experience it.
The truth is, the seeds are often sown in doctor's appointments. Clinic rooms, telehealth Zoom rooms, hospital rooms are anxiety chambers. The environment is not conducive to the kind of reflection and vulnerability required for skill building. And that is a lot of the stuff that we do, including the skill to be with, I can't fix this. It's incredibly uncertain. I'm really scared. And I'm here. I feel like we do not do grief justice, right? And it's part of why we think about illness, grief, and dying is that we have landed grief on the other side of death, right? We have sort of packaged it as the response to a death, to bereavement. We've made grief and bereavement synonymous. And I think that what we know about the experience of illness and bodies changing is that even before diagnosis, this is a grief process because something is different. I think of a lot of this as grief work. I think that there's so much life there because I really hold dearly this idea that the more grief we know, the more grief we make contact with, the more joy we know, the more beauty we can know, that these things expand our capacities equally on both sides.